From new funding to drive innovation in mobility and physical health to care models that bring services closer to where people live, Singapore is stepping up efforts to help its people stay healthier for longer as the population ages. These moves are part of a broader push to support early detection, prevent illness, and bring care closer to home by shifting support from hospitals into the community. Osteoporosis screening could soon be subsidized under national program Healthier SG, which has enrolled close to 3 in 5 of eligible participants to date, and to drive innovations that target musculoskeletal health and other conditions. Fresh funding of nearly $38 million to develop tech tools. But what's important is to identify emerging risks early, says Health Minister Ong Ye Kung at a community event.
We want to encourage more people to go for screening. So MOH, we are working with the doctors to develop healthcare protocols. And there will be protocols to prevent frailty, to encourage people to go for bone screening tests. It may take a while for us to do this, a lot of consultations. But once it's done, expect better subsidy for bone density screening.
Recent studies found that osteoporosis affects nearly 60% of adults over 60 in Singapore, and there's a greater need to take care of musculoskeletal health. Close to $38 million will also go into Phase 2 of the Future Health Technologies program, with musculoskeletal health being a focus area alongside mental well-being and rehabilitation. Tech tools that can be developed include using AI to predict fracture risk, wearable sensors to detect falls early, and robotics to support recovery at home. Developers say such innovations could allow more people to stay active and independent for longer.
What we're really trying to do is accelerate clinical translation. So that's where folks like myself, as an orthopedic surgeon in the hospitals, in the health clusters, we're looking to adopt many of these promising technologies into our health system and have patients directly benefit from these technological advances.
Neighbourhoods like Boon Lay and West Coast are playing a more prominent role in frontline healthcare for seniors, with care shifting out of hospitals and into everyday spaces. The Healthy Precinct model brings together healthcare providers, government agencies and community groups to deliver preventive care on the ground. Using outreach and local programs, seniors can access screenings, follow-up care and activities in familiar spaces like community centres and around coffee shops.
Then, of course, active aging. All these programs are not just to benefit our seniors, but also to empower our seniors to themselves step up and be active agers, to be active volunteers, to organize programs for other seniors, to help look out for other seniors, particularly those who are frail or those who are isolated.
Beyond medical care, the initiative also focuses on reducing loneliness by encouraging seniors to stay socially active and connected within their communities. The model is now being expanded to more neighbourhoods across the Western region and beyond, with plans to roll it out more widely over the next 2 to 3 years. And seniors are seeing its benefits.
Extra motivation and to encourage me to keep me going on, and also to strengthen my friendship together with my neighborhoods.
Loneliness and unhappiness affects longevity, affects your entire being. And in fact, it also affects the family. So the whole idea of healthy aging is good for yourself, good for your family. And when it's good for yourself and your family, it's good for the nation.
Community health pods will be progressively rolled out across 11 sites in Woodlands under a pilot that aims to bring care closer to residents. Housed within or near active aging centres, it will be more convenient for people to check simple health indicators or have video consultations with healthcare professionals. The new pods are part of upgrades to existing community health posts as part of efforts to shift care into the community as the population ages. The posts will now operate weekly instead of the previous fortnightly or monthly. They will be staffed by community nurses and health coaches. Compared to before, residents can now walk in without a referral and access a wider range of services, including teleconsultations. Anyone aged 18 and above can seek advice, perform basic checks, and get support for chronic conditions.
Yeah, we are actually gathering feedback from the residents to try to refine and see what can best meet the needs. So there will definitely be more health pods coming up progressively as we roll out.